My name is Dr. Hatem Soliman. I'm one of the medical oncologists in the Center for Women's Oncology at the Moffitt Cancer Center, and I specialize in breast cancer. Well, what drew me to breast cancer, I would say, is that I had a very fond, attraction towards medicine in the sense that I really wanted to care for truly sick patients. I didn't feel that I wanted to go into a field that was not challenging, that they didn't really require my aid and my help in a very challenging time. For me, I think that kind of epitomizes why I became a doctor. And so I felt that breast cancer in general was one of the most challenging types of medical oncology that you could specialize in, because it's very individualized, it's very personalized, there's a lot of information that you have to stay abreast of and keep up on in order to do a good job for patients and to give them the best treatment possible. So that's what drew me into the field, specifically for breast cancer. Well, I think what sets the Center for Women's Oncology at Moffitt apart from other treatment facilities is that we really engage in a very strong multidisciplinary team effort approach that brings in a lot of different players, more than just potentially could be available at a standard center. And I say that not just from the surgical oncology standpoint or the medical oncology standpoint or the radiation oncology standpoint, because there are centers that do have those disciplines and they do interact with each other. But us being the only NCI designated comprehensive cancer center in the state actually helps us bring in also basic science disciplines as well into the care of patients, and to integrate that into our protocols, our research plans, also using total cancer care to try to study patient tumor samples and information that has been collected over the years in order to refine care, in order to maybe discover new avenues for treatment. So I think those are the things that set us apart from other treatment centers. So my main focus actually in the breast cancer medical oncology section is that I'm focused on immunotherapy trials. So what I want to do is try to harness a woman's immune system in order to help her better fight off her cancer, to either help her respond better to treatments if she's metastatic, or we hope so in the near future as well to have effective therapies to better reduce the risk of a recurrence in the first place. Because women go through a lot of treatments with chemotherapy, radiation, surgery, and I think that it is time to try to integrate various new treatments like vaccines and immunotherapies to try to help a woman's body naturally fight off the cancer more effectively, rather than kind of integrating or piling on more chemotherapy treatments or more kind of drastic types of treatments that could carry with it longer term side effects. So from my standpoint, I want to improve quality of life without compromising on the cure potential for our treatment. So that's what I focus on. Well, one thing that I also do in the department is that I do see males with breast cancer as well, so that we feel that it may allow us to better communicate or have males relate better to having a male physician speak with them about their breast cancer, as it is a pretty rare disease in males, and so that they may feel that they're a little bit out of place in that setting, and so it's trying to potentially provide them an additional comfort to have a man kind of just relate to them a little bit better about what they're going through with their disease. So I do see those types of patients as well at the Moffitt Cancer Center, and we try to also strive to provide them state-of-the-art care in our clinics as well. I think in general it's an exciting time for oncology, and it's actually reflected, I think, in how popular the field is as well with incoming trainees. So you can usually gauge when there's excitement about a particular field by how competitive it is to get into these training programs, and it is very competitive now to get into medical oncology. And I think that a lot of it stems from the fact that we're seeing an explosion in new treatments and new options for patients with cancers, and especially in breast cancer. We're finally getting to essentially look under the hood of the cancer cells, whereas before we were using rather crude treatments or methods to try to eradicate the tumor, but it really was a generalized treatment that didn't have a lot of specificity, had a lot of side effects. Whereas nowadays, I feel that we're really starting to target the actual errors that occur in cancers to try to exploit those weaknesses in the tumors and improve treatment. And so I think that that's something that's also very exciting, and I think within very short time, within at least the time that I'm practicing, we probably won't recognize the field of medical oncology.